Hello everyone, I am Bharat Reki, a pathologist at Tata Memorial Hospital. At the forefront, I would like to thank JustCap for giving me this opportunity to share my views on this Sarcoma Awareness Month. So just to share with you all about sarcomas, we know that sarcomas on the whole are rare tumors because they form less than 1% of the total cancer burden. But at the same time, you see these tumors happening in the bones as well as in soft tissues. And in soft tissues, you have more than 100 sarcomas. And these are complex and can be difficult to diagnose by a routine pathologist. So therein lies the importance of a specialist pathologist working at a cancer center. Now coming to the risk factors, most of these tumors are idiopathic, but they can be associated with radiations, for example, malignant peripheral nerve sheath tumors, or maybe certain cases of osteosarcomas that we see as the most common malignant bone tumor occurring in pediatric patient. You can have rarely genetic basis towards tumors like MPNSTs, then you can have ionizing radiations associated tumors or neurofibromatosis associated MPNST, like I mentioned. And then which is important is to actually diagnose these tumors, because and before that it's important that the patient recognizes this tumor in time. So if there is a lump and bump in the body which is large sized, causing pain, causing difficulty at any site, and if there is an ulceration, so the patient should refer to the specialty oncology or the cancer center at the earliest possible, because there is a possibility for a large deep sided tumor to be malignant. So having said that, we have these bone and soft tissue tumors as benign or malignant tumors. Now coming to these tumors, how they are diagnosed. Bone tumors are diagnosed firstly on the radiology. So there are certain signs which tell on radiology whether this could be a benign tumor or a malignant tumor, in terms of also the age of the patients. So certain tumors occur at certain specific ages, both in soft tissues and in bones. So after the diagnosis of a bone tumor on radiology and on MRI for a soft tissue tumor, these cases head for a biopsy. So biopsy is wherein the role of pathologist comes as a very important part of the clinical team, and the pathologist has to separate whether the tumor is benign or it is malignant. A malignant tumor is the one that has more chances to spread in the body and it can recur. Something in the middle is intermediate malignant. So those they can be recurrent tumors, they can come repeatedly, but they rarely metastasize. So it is important that we separate the tumor as benign or malignant. Now that's what the pathologist does. So with a biopsy examination, and further, if it is a malignant tumor, we have to grade it and we have to type it. Now, high-grade tumors again have more chances to be malignant, more chances to spread in the body, and they have more chances to be recurrent, in contrast to low-grade tumors. Apart from the grading, the staging is also performed, which is clinical and pathologically related in terms of the tumor size. And then comes typing, so further subtyping of the tumor. Like I mentioned, in bone tumors, the most common is osteosarcoma, followed by Ewing sarcoma, and these tumors occur in mostly pediatric and adolescent patients. In soft tissues, you have these tumors again coming more common in pediatric, adolescent, and young adults, but they can occur in all ages. But you have different tumors that occur in different ages. For example, you have rhabdomyosarcoma, which is more common in pediatric patients. You have a synovial sarcoma, which is a chemosensitive tumor. Again, rhabdo is also a chemosensitive tumor. Synovial comes in young adults, and liposarcomas, dedifferentiated sarcomas, liposarcomas, and pleomorphic sarcomas, which are relatively less chemosensitive, occur in older patients. So you can see that it's important to type, grade, and stage both malignant bone and soft tissue tumors. So this is very important that we are able to furnish this information, and this will have a bearing on the clinical management. Like I mentioned, certain sarcomas are chemosensitive, like rhabdo, Ewing's, and osteosarcomas, in contrast to pleomorphic sarcomas, which are not chemosensitive. And now it is becoming even more important because you have certain tailored or targeted therapies, which will come in detail from our oncology colleagues, like for example GIST, which is a gastrointestinal stromal tumor which happens in the abdomen, which is very sensitive to a drug called imatinib. So all these tumors need to be accurately diagnosed in time, and the patients need to be referred to the center, specialty center, also in time. I again thank the JustCap Foundation for this opportunity to share my views, particularly related to the occurrence of these tumors, related to the diagnosis of these tumors, and what impact it's going to have on the management. Thank you very much.